When you talk about heart disease, I don't think a lot of people realize that cardiovascular diseases claim more lives than all cancers combined.
That is correct.
So over and over again, I'm hearing, and you hear of somebody, man, they just dropped dead, or they had a heart attack, and before they hit the ground, they were gone. Talk about people like Tim Russert and other people like that.
That's right.
What's happening in those kinds of situations?
So, but whenever you say heart disease, you have to ask a simple question. What type of heart disease are we talking about? One, the heart is a simple pump. It pumps blood to the rest of the body, and it has its own blood supply. There are 3 arteries which supply blood to the heart muscle. Now, when you look at an artery, it's a simple tube. Once you look at the tube, you have 2 types of plaque. One is a small plaque which is not obstructive. Another one is a critical plaque which is obstructive. Now, when you have a tight plaque in the artery, every time you exercise, every time you walk, you start having chest tightness and shortness of breath. Now, that type of plaque rarely kills. The 20–30% plaque which you see in the artery, which forms in 10 to 15 days based on bad diet, that plaque can crack and close the artery and cause sudden death. So when you say you hear of people dropping dead, the reason they drop dead is because they are doing fine, their arteries are clean, suddenly within 3 to 4 weeks they start forming a plaque. The plaque is around 20 to 30% plaque, and suddenly the plaque cracks and there's a volcanic eruption and the artery closes and you drop dead. Whereas the other one takes years to form and gradually builds. That type of plaque usually causes symptoms. That's where you end up going for bypass or stent placements, and usually don't die of heart attacks. Yes, so there are 2 types, like 2 sides to a coin. There are 2 types of disease. One, slow, gradual progression of disease which incapacitates you but does not kill you, gives you symptoms, leads you to go in for bypass or stent placements. The other one is rapid formation. In spite of taking all the medications, you could still form a plaque, and the plaque can crack, close the artery and drop dead. That is the reason why you see a sudden increase in heart attacks in the last 2 weeks of December and first 2 weeks of January, and the most number of heart attacks always traditionally happen on the day of Christmas.